First thing you do when you get your vent orders is you want to check the physician's orders, make sure the vents, you got to confirm the order, make sure you're actually going to be having a patient on mechanical ventilation. Second thing you do is you go in your room and maintain your sepsis, wash your hands, make sure everything's sterilized, bring in all your equipment, select and assemble your equipment. Your equipment would be your vent, you got to get your vent set, your O2 line plugged into the wall, your air line, your room air line plugged in, attached. Make sure they're both on, running at 50 psi out of the wall, so this should run for the system anyways. You want to get your circuit, which will include your corrugated tubing, your Y piece, and your Ballard inline suction. You'll set all that up, and you're going to test all the equipment for proper function, which means you're going to go through your initial setup. Once you turn it on, it'll ask adult or infant, and do you want to start pre-use check, which you check yes, and it'll run through it. Internal test, barometer test, gas supply, pressure test, connect the tube between inspiratory and expiratory outlets where you plug it all in. It's all here on the sides. Inspiratory and expiratory are both marked. And hit OK. Gas pressure, internal leakage, and all that good stuff. Of course, it's not going to work. Excessive leakage because we don't have the Ballard on and we don't have it capped off, but that's all right. We'll go ahead and cancel. Keep going with it. Of course, it'll show you if it failed or anything. And this basically is your vent checks to make, or your initial startup check is your pre-use checks to make sure that there's nothing wrong with the equipment, prevents lawsuits, make sure that the patient has proper care, best care we can provide. Leakage, we know there's a leakage, of course, and yada yada. It's going to fail most of these. Pressure transducer, safety valve test, all the fun stuff. Sometime today. So it goes through everything. I'm going to go ahead and cancel it. Okay. Okay. Why did it? Go ahead and go into volume control. You've got all your modes, all your settings you can adjust either by clicking on them and adjusting based on what your doctor wants your patient set up on. Tidal volume, respiratory rate, PEEP, O2, inspiratory time. It all adjusts, i.e. your inspiratory-expiratory ratio, your minute volume. It all adjusts automatically. You can either accept here or you can come down here for like tidal volume or whatever you've got set at the bottom. These will also adjust once you've got your vent running and going. Check all your monitors as needed. Thank you. Then you can adjust all your alarms. All your alarm settings will be up here under alarm profile. Everything's set. Upper pressure, low upper minute volume, low upper respiratory rate, and expiratory pressure. Once you connect the patient to the ventilator, you adjust the ventilator and the settings according to what the patient needs. Get your ABG, check your pulse ox, perform airway care as needed, clean up your area when you're done with everything and set everything up, and then document everything in the patient's record. That's it.